Welcome everyone. Hi, my name is Holly Hood and I am the Program Service Coordinator here at the Chromosome 18 Registry and Research Society. We're so happy you've joined us for our Closer Than Ever virtual conference. And today we are about to cover the session on Social Security Disability, Getting It and Keeping It with John McGing. Today's session is pre-recorded, but don't worry if you miss a session, we'll have those available after the conference. You'll receive an email with more details. Also, just to let you know, we won't be recording the self-advocate or the sibling panel. I do have a few quick announcements and housekeeping items to go over before we start the presentation. If you have any questions during the presentation, please feel free to type them into the chat box, and one of our staff members will share them with the presenter after the conference. Also, please remember to mute yourself and turn off your camera during the presentation. We really appreciate it. And we have our silent auction. It is now open, so please feel free. I'll go ahead and pop the link into the chat box. Feel free to explore all the items and hopefully you'll be able to bid on a few for you and your family. And did you get a chance to order your merchandise yet? We have our link that is still active, so we'll go ahead and pop that into the chat as well if you're interested in purchasing some Chromosome 18 merchandise. It's still available. And I do have an exciting announcement. Coming up tomorrow evening, we have the Starfish Family Fun Night and Table Touring event. If you haven't got a table for your family but you're interested, we will put that link into the chat as well. So please feel free to visit that link and sign up a table for you and your family. Without further ado, we will get started on the presentation.
Thank you for coming. My name is John McGing, but before we begin, I just want to comment on the audio. I've done this a number of times, but I can't get the audio to where I want it to be, but it's the best that a webcam microphone can do. So if it's too booming or too soft, please adjust it for yourself. But if it sounds hard and echoey, I'm sorry, there isn't anything I could do about that. Okay, this presentation. I'm doing this because I worked at Social Security for almost 40 years, and the topic is of disability benefits, both Social Security disability and supplemental security income disability. I'm not going to go into a lot of detail about non-disability issues, such as the income and resource aspects of SSI and all the ins and outs of retirement versus delayed retirement. Those are long and separate issues. My focus today is on disability. What is disability? And what do you need to prove that one exists well enough to be entitled to a benefit through Social Security? This PowerPoint is your takeaway. You are urged to download the files and keep it as a resource. Later on, if you're filing for benefits, go over it, refresh yourself, think about what it is you're trying to do, and use the information in it to help you make your claim a little bit better. The subject is complicated, the slide deck is long, and I'm going to be addressing key points for the most part. I don't want to just read the slides to you, but I do hope you'll go over them on your own later. And I may actually have a random thought to share that isn't in the PowerPoint. I do want to familiarize you with key things while you work at your own pace. I understand there'll be an online question and answer session scheduled where I can answer specific questions about this presentation. If your questions are detailed, we may arrange to speak offline later to avoid taking up all the time for the other attendees. One final key point. Please understand, I do not represent Social Security, and my opinion or my explanations of how things work do not substitute for you filing a claim and getting an official decision from them. If you want or need an official answer to your eligibility or that of a loved one, you must file with Social Security. What I tell you today is informational at best. So let us begin. In terms of the table of contents, this is more important for if you're reading this offline. There's a lot of stuff here. Basically, I'm going to go over as much of this as I can at a high level. And again, a lot of this is intended for you to use later on. Brief history. I think context is important. Social Security is no different. For example, we use the term Social Security in a lot of ways to represent the agency, Social Security Administration, that runs the program. We also use it to generically represent the programs. Oh, I get Social Security benefits. It can be confusing sometimes, and then you add in SSI, and it gets interesting as well. But understand that Social Security started during the Depression and initially only provided retirement cash benefits to workers and then later to their families. Then it paid benefits to survivors of deceased workers. And since 1958, it pays those who are disabled and their families. A key note here is that 1958 is also when the definition of disability was formulated. So life in America, the work environment in America in 1958 is basically encapsulated in the law and the rules and the regs that govern Social Security disability. Supplemental Security Income is also an old program. It came out of the same amendments in 1935 and was originally administered by the states. Supplemental Security Income, SSI, is not Social Security income. You say that to people and it is just confusing. I think it helps to know the terms. The thing about SSI is that it was administered by the 50 states and the District of Columbia, and it was a mess. And so Congress in 1972 took the program back from the states, gave it to the Social Security Administration to administer, and the rules established in 1972, and remember America in 1972, what it cost, what the average wage was, what the income was, what things cost to pay rent and buy food. Those were the limits established at the time, and also haven't changed much over time. The key thing about SSI is that it is not Social Security. It is not funded by FICA taxes. It is a welfare program funded by general revenues. And as such, they are distinctly different programs. I bring this up because the two are often confused, and that confusion can hurt you. Social Security is social insurance, an entitlement where you pay your premiums as the FICA tax you pay. Well, I'm sorry for the phone. For the FICA tax you pay, while SSI is welfare, something you have to meet eligibility requirements for and something you're not entitled to. You might be able to get it. It's not an entitlement such as Social Security, whereas if you've paid the insurance premiums and meet the basic requirements, it's something that's yours. A person can get one or the other or both, but they are very different programs, and it's important to keep those differences in mind. Factors of eligibility. Factors of eligibility are, by law, those things that you have to meet in order to get the benefit. And these programs have two kinds of factors. The first are the non-medical factors, and the second, the medical ones. That may seem really common sense. It's just that as you deal with these things, you can get confused or lose track of what it is you're actually talking about. The non-medical requirements are, briefly, for SSI, for example, is are you poor enough to qualify? While for Social Security is have you worked enough and paid into the system in order to be covered or insured? The second factor, the disability factor, uses one common definition, just pointing out that both programs share the same definition of disability. The other entitlement factors are different, but they share the same definition of disability. And that's important. You ought to know what the definition of disability is, and it can be bureaucratic. But SSA generally defines disability as the inability to engage in any substantial gainful activity by reason of any medically determined physical or mental impairment, which can be expected to result in death or which has lasted or is expected to last for a continuous period of not less than 12 months. That's in the law. But to translate that, It's basically you must be totally or permanently disabled and unable to do any work, not just your old job, to qualify. There's no provision for partial or temporary disability, and that's true for both Social Security and SSI. Now, for Social Security, you have a thing called insured status. And I bring this up simply because for young people, they haven't been in the workforce long enough to pay 10 years worth of Social Security benefits to be insured. So this chart explains what you have to earn and the number of quarters you need in order to be considered insured to file for disability. I bring this up because you could have a young adult who's been doing part-time jobs who earns enough income, say from age 16, say to 21, 22, that if they filed for disability because they have chromosome 18 disability, they may have earned enough work credit to be insured to file on their own account. So that's why it's important to know. Now, quarters of coverage. For the Social Security benefit, you have to be insured by earning enough quarters of coverage. But what is a quarter of coverage? In the old days when taxes were submitted quarterly to the government, if you earned $50 or more in a calendar quarter, you got 1/4 of coverage. So over the space of, if you worked every quarter and earned over $50, you got 4/4 of coverage. That changed in 1978, and that's not all that important, but the bottom line is that you need to earn a certain amount of money every year, and every time you earn that amount, you get a quarter, and you can actually earn your quarters of coverage all in a 2 or 3 month period, as opposed to having to earn them over the space of a year. So the key thing is if your work history is scant, the only way to know if you are insured and therefore eligible to Social Security for disability is to file and have them look into it for you. If you go and you file and they say you lack enough work history, then you won't be eligible for Social Security disability. Earning a quarter of coverage, like I said, before 1978, it was just if you earned $50. In a calendar quarter, you got 1/4 of coverage. Now, it's in 2021, for every $1,470 you earn, you get 1/4 of coverage. So if you earn $10,000 in a month, you get 4/4 of coverage. Over the space of a year, if you earned whatever 4 times $1,470 is, you'd have 4/4 of coverage. Now, one key thing here that I need to stress verbally here is that I'm talking about workers being covered to file for disability. Now, you can be a covered worker as a parent of someone who has a disability. And if you become disabled or retire or you die, your family member can file and receive disability benefits even if they've never worked a day in their life. That's called the Disabled Adult Child Benefit. Similarly, a widow whose husband has passed and who has never worked but is disabled can also file for disability even though she's never worked. So the point here is that someone who has a child who was disabled before age 22 can get a disability benefit under Social Security without having ever worked, but only if the parent is disabled and getting benefits, retired and getting benefits, or has passed. But for a worker, you need to have the quarters earned. Okay, so I'm going to shift gears here because that stuff is stuff no one needs to keep in their brain. It's just stuff you need to be able to look up when the time comes. If you're going to file for a claim for you or for a loved one, you're going to be dealing with a couple of different organizations, and you need to know who they are and what their role is. Social Security field office is your primary contact. Normally before COVID, you'd go in. With COVID, most everything's teleclaims. You can still do Teleclaims and going in the office will probably be the two key ways to get things done, but right now, over the phone is essentially it. Yes, there is some ability to file online, but I honestly don't recommend that for filing for disability because it doesn't really encourage you to do all you should be doing to help yourself during a claim. Now, the field office is responsible for gathering in the information, ensuring you meet the non-medical requirements like your work history is adequate or that your income and resources are below the SSI limits. They prepare the case file, and they basically make sure that we know you're a citizen, your marital status, take all the information, and then they're going to send it to an organization called the DDS. And the DDS stands for Disability Determination Service. They actually make the decision, not the Social Security office. And they are the ones who say yes or no initially for disability. So the DDS is a state agency. It's not an arm of Social Security. It is an arm of the state government. Interestingly enough, done that way because in 1958 there was some fear of the federal government having that kind of power over citizens, so they gave the power to the states to declare you unable to work. The DDS makes the disability decision for SSA. Although they are state employees, their funding is completely by Social Security Administration. Their trained individuals and doctors review the case, request more evidence. They do all the work on an initial claim and at the reconsideration to determine whether or not you meet a disability. And they do it using certain tools we're going to talk about a few slides down. Okay? So the key thing about the DDS is they are not the field office. Field office has to ask them what's going on with the disability claim as much as you. But you file with Social Security at the office, they prepare the file, it goes, the medical portion goes to the state office, the state DDS, and the state DDS does the work. They may contact you, they do whatever it takes to try to develop the disability information. Now, if you get denied, there's appeals. And at one level of appeal called the hearing, you're going to be dealing with administrative law judges who work in an office called the Office of Disability Adjudication and Review. I only bring it up because if someone says you're filing for a hearing and you're going to be dealing with ODAR, that's who these people are. They are not the field office. They are not the DDS. They are a separate organization whose separate staff will now be involved in reviewing your case file and making a decision. So there's three components here you could potentially be dealing with if your claim isn't approved. Okay, now, this is actually a key slide. I've said this verbally before, but here it is in writing. It's really important. I'm actually going to read it. It's that important. Social Security benefits. Your eligibility is based on a wage earner having paid FICA tax. You must be a citizen or legal alien. The wage earner, their spouse, or children can get benefits, either life benefits or death benefits, on a person's account. Benefit amount is computed based on the wages the wage earner earned. And there are no restrictions on other income or assets for beneficiaries. You can be a millionaire, you can be a pauper. If you paid and you're entitled to Social Security, you get what you're entitled to. Supplemental Security Income, SSI. It's a fully needs-based program. It's a welfare program with restrictions on income and resources to be eligible. The payments are technically for being aged over age 65, blind, or disabled, with no other sources of support. The payment level has a payment ceiling, and there are dollar-for-dollar reductions for other income. Entitlement is only for the individual, so if someone is married, there is nothing for their spouse or children, unless they are also disabled, aged, or blind. And there are no benefits upon death. With SSI, a person will generally get Medicaid benefits. I need to point out with Social Security disability, after 24 months, you can get Medicare. Now, I'm going to do a brief recap here. We just went over there are two kinds of benefits. Social Security disability, you, a family member, like a disabled child, you get based on work history, and one supplemental security income that is a form of welfare. You can be eligible for one or both. Their rules, the non-disability rules, are the same. But the rules for disability are the same for both programs. Repeat that. The definition and decision on disability is the same for both programs. The only difference is, just to be technical, is if you're a disabled widow, there's a slightly harsher disability definition that gets added into the mix, but we're not going to talk about that. For the most part, you're filing for Social Security disability or SSI disability. If you're entitled, become declared disabled for one, you're going to be disabled for the other. Now, spending a lot of time on this because the rules are important and it's easy to get messed up. One key thing I'm going to read from this: congressional committees were really very conservative about disability. It needs to be a physical or mental impairment. It must be of a nature or degree of severity to justify its consideration as the cause of failure to obtain any substantial work. Standards for evaluating the severity of disabling conditions are worked out in consultation with the state agencies. They will reflect the requirement that the individual be disabled not only for his usual work, but for also any type of substantial gainful activity. So my point here for reading this is that the program is very conservative. Just being disabled isn't enough. You need to be disabled enough to not ever be able to do any kind of work. Definition of disability. Now, they use the same definition of disability, but there's an adult version and a version for children under age 18. So, adult's version, child's version, it makes sense. An adult likely has work history, a child likely has never worked. Therefore, you can't use the adult set of definitions and templates against a child because they'd be discriminatory. Now, one of the key things is that the law says substantial gainful activity, also called SGA. Basically, what that means is work activity is gainful activity, working. And substantial just means it's enough to basically pay your way in society. So with gainful activity being another term for work, and substantial meaning that it produces income at or above a certain level, it is presumed that such work provides enough income to be livable, meaning if you have a disability but your work is ongoing and the work is at a level that is substantial, you're simply not disabled enough to get a disability benefit. So you can have a disability but not be disabled enough. Unlike VA, where you can have a 50% disability, Social Security is a 100% disability by law. You can read the definitions for adults and children. I want to keep things moving because time is moving along here faster than I want. What is a medically determinable impairment? The law says the impairment must be medically determinable. That just means you got to have proof. It can't be allegations. It can't just be someone saying Joe Doe is disabled. It has to be something that is anatomical, physiological, or psychological that has medically acceptable clinical testing or records that show diagnostics have been done that are in line with normal medical standards. So the evidence must exist, it must be obtainable, and it must show impairment, showing signs, symptoms, laboratory findings, a statement of symptoms simply by someone, or a doctor's note that says Joe Doe is unable to work. simply will not cut it. It has to be provable. It needs to be something that you could give to 3 different groups of people and say, is this person disabled? And they say yes. Based on the evidence in this file, we would agree this person is disabled. Now, the disability decision gets made, and this gets fairly technical. But you've done your paperwork, you went to the field office, you've done everything out, filled everything out. They've sent it down to the DDS. Now, what happens there? They're going to follow a multi-step sequential evaluation process. And it's long and it's technical, but the key thing here is that in this multi-step thing, if they reach a decision where, yes, you meet the requirements of the law at that step, then they're done. They only do all the steps in the process if they can't approve you at any higher level. That's the general process. Now, adults' 5-step process is different from a child's 5-step process. So the details will differ, but the framework is the same. So they look at these things: the claimant's work activity, their current work activity, and what they've done in the past, the severity of their impairment as documented in the evidence. Then they look at a book they have that lists out what criteria must be met to be considered to be disabled. If that doesn't do it, then they look at your residual functional capacity, which is, are you able to do work, and what kind of work are you still physically able to do? And then lastly, they look at all of you as your past work and ability to do other work, and they look to see if the combination of everything that's wrong with you prevents you from working. For a child, it's similar, but because there is no work activity, usually it's the severity of their impairments and whether or not their impairments are in marked or severe, result in marked or severe limitations. But at this point, if they clearly say, no, you do not meet the requirements, then we're done. So this is one of those kind of things where it's a multi-stage process. So for some people, it could happen and they get good evidence and they get approved early in the process. Or some people with bad evidence, takes longer and longer to make a decision because they don't have enough to make a decent decision. This is kind of a stepping to the side for a moment, but it comes up where people ask, why does it take so long? Well, it takes so long because there's this multi-step process. But what about, yes, sometimes common sense does prevail, and the law does allow that certain conditions are so clearly disabling that we can presumptively say you're disabled. We're still going to get the proof, but we're going to presumptively say you're disabled and speed you through the process. So a presumptive disability or presumptive blindness are such things as stage 4 inoperable cancer, renal failure, severe mental deficiency where someone is totally dependent upon others for their personal needs. And the HIV stuff is different because treatment is getting better in that area, but some very high, not just having HIV, but having an active HIV that doesn't respond to treatment. That's called a presumptive disability. So these people can be approved right away. That's not going to be anyone in chromosome 18. There is a thing called compassionate allowance, and chromosome 18 actually has a syndrome on this list. And this is simply, again, another way of identifying situations where the allowance rate is almost always 100%. So why drag it out? The compassionate allowance list exists, and things can go on the list and can be taken off the list as technology and medical science gets better. Tetrasomy 18p is on this list. I think I actually suggested putting it on the list like in 2016, and it was put on in 2019. But I honestly think that as we learn more about the syndrome and we have better longitudinal data on how it impacts people, it likely will come off the list. I'm not saying tetrasomy 18p isn't a disability. I'm saying that there's enough variation in how it impacts people for it to not be considered a slam dunk like other compassionate allowance situations. But the key thing on this slide is when you look at this allowance, it says determination meets. We haven't talked about the listings. They're coming up shortly. But if you're an adult, you have to meet listing 1205. So if someone is filing for disability based on tetrasomy 18p, they would look at listing 12.05 for an adult and use the guidance in 1205 to outline and identify the medical evidence. If they're doing it for a child, they would look at the ones that begin with a 1, like 110.08, 111, 112, 11205. Those are what you use for children. We haven't talked about listings, but the key thing about compassionate allowance is they explain what the listing criteria are, which gives us some insight into what you as a person filing a claim should be giving information about. I didn't want to beat that to death, but yes, Social Security does have enough common sense that if something is fairly obvious, it doesn't drag it out if it can. Now, what do we do when we're making a disability decision? This is a big deal. This listing of impairments is something which is online. It's available for you to read. It gets updated periodically. And it describes for each major body system impairments considered severe enough to prevent an individual from doing any SGA, any substantial gainful activity, or if we're dealing with children under 18, are severe enough to cause marked and severe functional limitations. So basically, it's a cookbook. It's a thick tome of here's the body system, here's impairments, and if someone says this is making them unable to work, it lays out the criteria they must meet in order for them to be considered disabled. So these listed impairments are essentially permanent or expected to result in death. And they also sometimes include a specific statement of duration. Sometimes the evidence, well, let me step back. What this basically means is that all your evidence has to show that the impairment has lasted or expected to last for at least 12 months or result in death. And sometimes that isn't easy to do if your medical records aren't that great. Now, key thing to understand, as in the definition of disability, there's an adult version and a child version. The listings come in two parts, an adult version and a child version, Part A and Part B. Now, I'm kind of going over this in some detail because this tells you what the people in the DDS are looking for. It says they are looking for medical information that provides them insight into specific criteria. So if you're filing for a disability and you can look up what it is that they're going to be comparing you against, you can make sure that the medical evidence is there. You can provide it yourself. You can make sure your doctor knows that they're going to be looking at certain specific items and that these items are mentioned or addressed in your medical file. Part A is for adults, Part B for children. Note also for children, you can have other additional criteria. Again, children from 0 to age 3, children from age 3 to age 12, age 12 to 18 may have slightly different things based on their age because of their growing. So children can be complicated. Children can take a long time. But it's not just whether or not someone agrees or disagrees. It's whether or not the information you've provided or the doctors have provided is adequate to meet the requirements listed in the list of impairments. So this is an example of a listing for medical disorders for children. All the listings for children are in the 100 series, and for adults are in the non-100 series. We'll show more of that later. But a key thing here is that these are what we would look at if you're filing for disability for a child and they had an intellectual disability. The listing would be found in section 112.05. If you were filing for autism, it'd be in 112.10. Now, if there isn't a specific listing for the disability you're alleging, then things are just going to take longer. You're simply going to have to make sure your medical evidence is solid. But there's literally, and we'll see in a couple slides coming up, what is it that the doctors want you to meet if you're alleging, say, autism. Now, for both adults and children, activities of daily living are a very key factor. And I'm going to stress this because there are references to ADLs all over the place. And while you may think it's pretty self-evident, these are really critical, and the details are important, and people gloss over these details surprisingly often. There's value in knowing that a person can't be left alone or cannot follow instructions and can make a sandwich but can't cook, or is not allowed to use knives, or still uses diapers. These things are important facts. And even though you generally have been raising your child to accentuate the positive and stay away from the negatives, this is a time when the negatives are what's important. They need to know about daily activities from the time one gets up till going to bed, and whether they can drive, can they manage their own money, do they have hobbies, do they talk, do they understand commands. These are important, and especially when dealing with mental disorders. These things are vital, and you really need to be almost mean about how you evaluate your loved one when you're talking about these things. You never say nothing when what they do for the day. People don't just sit in a chair for 24 hours a day unless that's actually what they do, in which case that's very important. But if they can't cross the street on their own, if they can't make a meal on their own, if they don't know what money is, these are important items. Do not gloss over the deficits of your loved one. That's the thing you need to be stressing. So I'm running long here. I need to recap this for you. We want to assess a person realistically. Medical issues exist, but it's more than just that they exist. How do they impact the person? How is their life made less because of the impact of the medical issue? How are they affecting them? And not in general, but very specifically. And if these things can be addressed or ameliorated by medication or device like hearing aids, do they work? Are they adequate? Or they simply don't do enough to help a person the way they need to be helped? Is it permanent? Well, chromosome 18, yeah. How does it impact their activities of daily living? And what does it mean on their being able to work? This is really important, and you really can't stress this enough. Okay, at this point, we're halfway through, and I'm running about 6 minutes long, so hold on 1 second here. I want to go over these things, but we're going to kind of go over them quickly, okay? So they're important, though, so I don't want to just skim over it too quickly. We know there's two programs. We know they use the same definition of disability. We know that if you're an adult, it's different than if you're a child. We've kind of got a hint as to what goes on when they're looking at stuff. There's criteria that the people in the DDS or in the hearings office are going to want to see in your medical file. So evidence is key. Good evidence gets a claim approved. Bad evidence can get it denied or make it take longer than it needs to. Social Security will dig up your medical records for you, but the odds are they're not going to work real hard because it's not their claim. If you really, really want your loved one or yourself to be approved for a disability, you need to own your claim. You need to talk to your doctors. You need to obtain your own medical evidence. And understanding what the listings say the medical evidence should document, you need to get evidence and have it in your possession in multiple copies. Scan it if you have to, so that you can give it to Social Security and have a copy in your back pocket and give it to them when you file the application. You do not, unless it's the only thing you have, you do not want to ask Social Security to develop all your medical evidence from scratch, because I guarantee you the odds are strongly against that claim getting approved initially. It's simply not going to happen. Doctors are busy, hospitals are busy, they're going to pick the wrong record, they're not going to get the one that has the right information in it, and without that information in the file, Social Security make a decision based on what's in the file. And if the file is not good enough, the claim is going to be denied because it can't be approved unless the file is good enough, and the only way for it to be good enough is for the medical information to be in there, and the only way to guarantee that the medical information that needs to be in there is for you to put it there. So you need to be the person managing your medical evidence. You're going to get your medical evidence from your doctors, from your hospitals, from psychologists, from various specialists like speech language pathologists. If you're dealing with children, you're going to be doing things like schools and other places that have been dealing with your kids. We need evidence from treating sources. We want longitudinal data. That means we want data from doctors who've seen you over time. We don't want evidence from a doctor who's seen you once. Well, we'll take it, but that's not going to carry a lot of weight. We want evidence from people who've been treating you for a long time, or which give us an insight into your condition. We want hospitals, clinics, other places. They're going to give us, a list of symptoms. It's going to give you the tests that were run. It's going to give you test results. It's going to give you diagnosis. It's going to tell you how well you've responded to treatment. That's the information that you really got to have in file. We also want to know whether or not it's going to impact your ability to work, especially for children who have never done any work. We're going to need things like caregivers, social workers, but we'll take other places, public and private agencies. These people can give us insight, especially into kids, because they're going to have IEPs and various things that are going to be important. But we will take evidence from anybody who will give us, but we want the best evidence that we can get. Now we're doing all this evidence, we're grabbing it all up, you're preparing it for deciding what's going on. And if you've been in the hospital, you might have been in for 3 things. We don't really care about the kidney stone. We don't really care that you had your appendix out. Don't provide those hospital records. We want the hospital records related to the time you were there for something related to your disability. And those records are going to contain the information you see on this slide. The key point in the bottom bullet in that slide is that if you're dealing with cases of mental impairments, we're looking for records that describe the person's ability or capability to understand, carry out, and do instructions and work in a work environment. When you're filing for a claim, read these slides over again and make sure that your medical evidence describes in these manners what it is that's going on. This slide basically says that children's functional limitations compared to other children are key. And some of the items they look at are attending, completing tasks, interacting, relating with others, moving and manipulating objects, caring for themselves, health and physical well-being. Children under 18, again, those are hard claims to get approved without solid information. The more information you have, the better things are. A lot of times people think a listing of symptoms is enough, and it's not. It's not just the symptoms, it's what the symptoms mean for the underlying condition or how things affect you. For example, pain is a symptom. So if you can manage your pain, that's different than if you can't. Or if you can only manage your pain in a way that has an impairment attached to it, the medications you take for pain impair your ability to work, that needs to be documented. So we need information about all the factors listed here and whether or not the symptoms of the disability are impacting the ability to work. Now, reason for denial, this slide just exists here so that I'm being thorough. If you've never worked enough or you have too much income, they're going to deny you on non-medical reasons. But if we can't find you, or you refuse to cooperate, or it's based on drug addiction or alcoholism, or there's certain crimes you've been convicted of, you may not be eligible for benefits. You'll find that out when you file. One thing is if there's a therapy provided that could allow you to work, and the reason you're not working is because you're simply ignoring the therapy, you may be denied because you're preferring not to follow therapy and not work, and that's a choice, and you don't get paid for choosing not to work. Now, the next thing I'm going to talk about is the 4 levels of appeal. We've talked about this briefly, and I want to keep this rolling because we're running towards the last quarter hour. If you file your claim, the field office, it goes to the DDS. The DDS will approve or deny your claim. If they deny the claim, they'll send you a letter, and in that letter will tell you you have the right to appeal, and that appeal is called a reconsideration. They will not necessarily give you a lot of information about the denial. They just say that it wasn't proved. You might need to go into the office and ask them to look in the folder to tell you what's going on. But if you file for a reconsideration, at that point you can provide more evidence, and you have 60 days to file for the reconsideration. So you can file for it and provide more evidence. They will send the file back down to the DDS, where a different group of people will review the old evidence and any new evidence and decide if they can approve it or not. If they can't approve it, then they're going to issue a denial, and in that letter you will be told that you can file for a hearing. Now, a hearing takes place in front of an administrative law judge, and those are those folks who live in that office called the Office of Disability Adjudication and Review. This is not the DDS, it's not the field office, it's an entirely different organization. These people, basically all they do is essentially 90% of their work is disability appeals. You may hire an attorney to do this. You don't have to. Many people do, but you have to file for your hearing within 60 days. The problem with hearings is that they can take almost 2 years to get scheduled. You file for the hearing and you get a hearing, and then you get an allowance, or you're great. The folder will go back to your field office, and they will effectuate the claim, and you will get your back pay, and things will start. But if you lose, you will have 60 days to file for an appeals council review. To be frank, appeals council reviews basically don't work, but you have to do it and get denied if you want to take some Social Security to court. People do. I'd say 10% of the cases that go to the appeal council get filed in federal court, and some people get approved, most people don't. It depends again on what kind of information you have in file, how strong your case is. You have a fair chance of winning. It's expensive, time consuming, you got to find an attorney. But in the end, only 1% of the people who file a disability claim actually end up going to court. But it's something you can do. Okay, now we have about 15 minutes. I'm going to go over some examples. I'm not going to go over them in huge detail, but if you have questions on them and you come to the question and answer follow-up, I will do what I can to talk to them. But I want to kind of just show the flow of how things work, even without getting real detailed, because I could spend a week talking about a lot of these things all by themselves. So we're going to look at a listing, walk through an example using autism. I'm just trying to reinforce key points. But my key here is that if you're going to file for benefits somewhere down the line, take a moment, read through this, go on and find the listing that applies to the disability, that applies to you or your loved one, and then look at what kind of evidence you need to have available to get the claim approved, and then work to getting that evidence in hand. Okay? So this is a listing on intellectual disability for an adult. It's 12.05. Intellectual disability for a child would be 112.05, 112.05. That's basically the difference. In terms of the numbering, the content can be very different. I'm not going to go reading through this with tons of detail, but you can see this is something that builds upon each other. It says, intellectual disability, significantly sub-average general intellectual functioning with deficits and yada yada. And before age 22, the required severity level is met in A, B, C, or D. So to be considered intellectually disabled for Social Security, there is criteria. 4 criteria. And if you meet criteria A, you're done. If not A, you look at B. If not B, you look at C. If not C, you look at D. That's how it works. So A is basically you're so disabled you can't take an IQ test. B is you've taken an IQ test and your score is 59 or less. C is you've taken an IQ test, it's less than 70 but above 60 or above. Then you have to have the IQ of that score alone plus other impairments. Or it's between 60 and 70 and you couldn't be met on C, but you meet at least 2 of these 4 restrictions on daily activities. So I'm not going to go through it in detail, but you can see it is a cake. Each layer builds upon the other until you get to either yes, I can do this, or no, I can't. Autism is a developmental disorder. It has a listing code. And we'll go over that in the next slide. But here's the definition of autism, which is important to know so that your medical file, if you're listing autism as a primary or secondary disability, you can document it appropriately. But if you're dealing with children, you want to read the bottom part of this slide because it's key to dealing with children. Now the listing for autism for adult is 12.10. For a child is 112.10. And this talks about what is for autism. It's A, medically documented findings of all of the following: 1A, 1B, 1C. If you sit there and just start at the beginning, read this, this is nothing more than an outline. It hangs together. Some people aren't autistic but have pervasive developmental disorders. So if that's the diagnosis, you would be 2, A and B, and for persons over age 18, B1 and B2, or 2 of B1, 2, 3, and 4. Okay? And then I took the listing from 11210 for children to kind of show you the difference between what the listing says for an adult and what the listing says for children under 18. And they're different, which makes sense because they are different stages of development. Again, I'm not going to go through this in a ton of detail, but if you read this and you read it slowly like an outline, it actually makes sense. If you skim it, you're going to go, what does this mean? Skimming is your enemy. This is literally a cookbook that the people in the DDS are going to follow. They are going to say, oh, John McGing filed for autism. Okay, autism means he needs to, A1, meet qualitative deficits in this. So I got to have proof of that. I need proof of 1B, and I need proof of 1C, markedly restricted repertoire of activities. And then I need in B, marked restriction activities, daily living, and marked difficulty, one of these 4. So these are the things I need to have. And I know that because it says when the requirements in both A and B are satisfied. And A for autism says 1 with A, B, and C, or for presumptive pervasive developmental disorders, it says 2A and 2B. And then for both 1 and 2, we need to have at least 2 of these 4 items in B. Yeah, I know. If you go over slowly, it makes sense. Now, here we go with a ton of words, but what it means is that for a child with autism, you're looking at listing 112.10, and they're looking for evidence that shows measurable deficiencies, evidence of measurable deficiencies. But for children like ages 1 to 3, how do you do that? Well, this describes what we're looking for. If they're between 3 and 18, this describes what they're looking for. And this describes what kind of tests they'll accept when a child can be tested at age 6 and above. See, I'm telling you, it's a cookbook. It's telling you what you need to have as evidence. And if you've never done any of these, or if your child has only been homeschooled and there's no school psychologist to give you information, you need to then be getting this information from an outside source and having it as part of your treatment plan. Again, for children, you have the 6 domains of functioning. I'm not going to go over these, but these are actually very, very good examples for adults as well. If you're saying someone has marked activities of daily living, these are essentially 6 domains of functioning are basically the children's equivalent of the activities of daily living. Pointing out that we want the opinions of pediatricians, nurses, occupational therapists, schools, IEPs, other kind of school plans. These are things you want to have on hand. You want to keep copies of. You want to be able to submit these things as evidence. So, prior slides were children. This, for example, if you were going to be filing for a child of yours, and autism is part of their range of disabilities, they're over 18, slide 45 explains what you got to look for. And at the bottom, it talks about the tests that are currently being used. These are listed in the listings that are online. But this page tells you what kind of medical information you should have in your file when you file the claim. Here we recap what happens if for some reason they say you don't meet the listings. Then they look at the residual functional capacity, and all the residual functional capacity means it's the most a person can perform in a work setting. At this point, we are looking at the human. We've got all this medical information. We have some information, but it's not enough to call for a disability. But they will now look at the various skills, including the physical things like being able to sit, stand, walk, the intellectual things and emotional things like working with others, concentrate on tasks, and they will look at these things in light of a work environment to see if, even though they don't meet the listings, if the RFC is such that they really are disabled when you look at it objectively as a whole human, as opposed to individually with these other separate kind of disabilities. Residual functional capacity normally won't come into play, but if it does, it's important to understand it. If our kids can't elevate their legs, or their ability to use their arms is limited, unable to lie down, or they run out of energy, these are things that impact the ability to work. They should be documented. If they can't follow instructions, if there's issues about working, they don't understand personal space, those kinds of issues, it should be documented, because that will play a role in deciding whether or not someone is disabled. So oftentimes, if you've gotten to this point, it's because the evidence you provided wasn't enough to approve a disability at the higher level of the 5-stage evaluation process. We're down at the last stage. But here you can get claims approved if you've been able to demonstrate that the whole human being, when you put all their limitations together, even though 1 or 2 of them by themselves are not disabling, all of them put together do equal a disabling condition. So, and I need to say that doctors are well aware of what RFCs are. They get asked this all the time by insurance companies, by short-term disability insurance companies, by Social Security. Doctors understand and work with RFCs all the time. Now, at this point, we're going to wrap up. The next couple of slides are simply online resources that if you have the PowerPoint, the link should work. If your situation is connected to the internet when you're using your tablet or desktop. I really wouldn't use this stuff with a phone. There's some questions and answers that are often here for you to read, so I don't have to describe them. And they're basically here so that we can avoid making this last any longer than it has to. But if you go to these resources, if you go to the listings and you read up on what it is, you will be able to better prepare your disability evidence packet and ensure that the claim gets treated with as much professionalism as you can, because you didn't give them the excuse that they didn't have what they need to be able to make a decision. That's essentially the bottom line on all this. So we're about almost out of time. At this point, I want to thank you for putting up with my somewhat echoey sounding audio. And if you do have questions, you can always contact me offline. Again, and I believe we'll be having a meeting shortly on this, and I can talk to you, I think, in live Zoom. So with this, I am going to get ready to terminate this video recording. I thank you for your time and energy, and look forward to talking with you offline or at the Q&A session. And good luck.